Hi, I'm Dr. Kevin Basralian. I'm here to talk to you about diagnosis and treatment advances in prostate cancer at Hackensack University Medical Center. First thing I'd like to talk about is prostate fusion biopsies. We used to do biopsies of the prostate for men who had elevated PSAs, doing a random biopsy. 6 to 12 biopsies were done. We missed a lot of cancers. If you look at the diagram on the monitor, you'll see that the green area is an area of cancer found by MRI, whereas the other candlesticks on the bottom really missed the area of concern. This targeted biopsy is what I'm going to talk about today, which is done by MRI. I'd like to talk to you about fusion biopsy of the prostate. Patients have an MRI performed, which is then put into a machine, a specialized machine done at Hackensack known as a UroNav. We can then direct biopsies based upon that information in real time. That is, the MRI is on one monitor. We have an ultrasound probe which we look at the prostate in real time, and together we can fuse or overlay those two images, directing our biopsies to suspicious areas. We could not do this before, and we've increased our accuracy by 100% by using targeted biopsies. Biopsies are done with a team of radiologists reading them, finding a system called a PIRAD system. We find those that have suspicious lesions, and along with dedicated equipment and sedation for patient comfort, we can guide our biopsies directly to the areas of suspicion, thereby getting much more accuracy. So what happens after we have a diagnosis? Well, we have to have treatments, and we have many treatments for prostate cancer. But a specific treatment I want to talk about is called HIFU, high intensity focused ultrasound. Developed in the 40s for brain lesions, adapted in the 1990s for prostate, this machine allows us to take ultrasound waves of a short distance, concentrate that ultrasound waves into energy, and kill the cancer cells. It's analogous to having the old magnifying glass 4 or 5 inches away. You can burn your hand or the paper, but in between you don't. Same with the ultrasound. Ultrasound waves pass through tissues harmlessly, but where they come together or concentrated, they generate heat. That heat is then allowed to kill tumor cells without damaging other cells, and we can direct that very accurately. The procedure is an outpatient procedure. It has no radiation, no surgery, so blood loss is not a problem. Patient comfort is easy. Patients go home the same day with a catheter. Patients' quality of life is maintained. Their sexual function, urinary control, and their daily living is unchanged. And we have excellent disease-free intervals. It's been studied for years. We have some great data on this. How the procedure done? I have a diagram here. You'll see on the left side of the prostate, the cancer is identified within the gland. We can then, with a probe in the rectum, generate ultrasound waves which go directly to the cancer cells, and we can treat that area specifically and accurately. The patient's done with the procedure afterwards, and what you have next is the area of treatment, either the left side, right side, or in some cases the whole gland. I'll talk to that later. This transducer, which is in the probe in the rectum, can be two-directional, so you can make sure you're getting the right area to treat. Ultrasound heats tissue specifically, almost a little like an area of long-grain rice, 3 by 9 to 12 millimeters. That's a small area that can maintain accuracy. These areas are pre-planned using the UroNav machine, the radiologist, and a surgeon with experience. So is it for everybody? No. There are some limiting factors. One is the aggressiveness of cancer cells. Very aggressive cancers might be treated with more aggressive treatment. Volume of cancer cells, the amount of cancer cells, and the location. So these are the things we have to remember, that every patient is not a candidate, but 20 to 30% of all diagnosed patients are candidates. Who are the potential candidates? One, patients with localized lesions. They're within the gland. We know where they are. We've documented it with the UroNav system, the MRI. We can treat them locally. Second, patients, ones who've had prostate cancer, radiation failures. Cancer comes back. 40% of those patients still have cancer localized to the prostate. We can treat them. And third, patients who are just being monitored and watched. They're not comfortable. We can do a minimally invasive without changing their lifestyle. They are a great benefit to be treated. So as you can see, we have some new treatments. They're excellent, and we're the only institution in New Jersey to have this technology. Thank you for listening.